How do I find a family doctor? Do I even need a family doctor? My doctor is not available. What do I do now? I'm going to answer all these questions today and tell you everything about the healthcare system in Canada. So stay tuned. Hello everyone, good morning. I'm Tanu and welcome to my channel. So today I'm going to give you an overview of the healthcare system in Canada and share my experiences with finding a family doctor and the struggles associated with it. Now, every province has a different set of rules and processes for their healthcare system, and today I'm going to speak only for Ontario because I live in Toronto. Canada usually has a public healthcare system where all your medical needs are supported by the government. Yes, that's right. Whether you visit a clinic, an emergency room, or get your blood work done, all of this is available to you free of cost. And this holds true for everyone, whether you're a citizen, a permanent resident, or on work permit. Once you land in Canada, make sure you're getting your Ontario Health Card done. This card is also called as OHIP card, which is Ontario Health Insurance Plan card. You need to just walk into your nearest Service Ontario Centre, carry your address proofs and ID proofs, fill in a couple of forms, and it hardly takes 30 minutes to get everything done. There is no waiting periods, and once you're eligible, you will have immediate health insurance coverage. Now, who is a family doctor? A family doctor is your primary caregiver for all non-emergency cases. They are usually the first doctors to diagnose and treat all of your medical requirements. For example, if you do need to see a specialist like a gynecologist or a dermatologist, your family doctor is the one who's going to refer you to those specialists. They also maintain a regular health record for you and order lab tests if required. Now, a lot of people think, do I even need a family doctor? I'm a healthy person and seldom get sick. I can just manage my illness with the over-the-counter medicines. Well, let me bust this for you. You only get very basic medicines like for fever, cold, cough, over the counter, and trust me guys, doctors here do not prescribe antibiotics unless that's like the last resort to cure your illness. And if you're a new immigrant, you are going to get exposed to a completely new weather, viruses, bacteria, and whatnot. And God forbid, if you do end up falling sick, you would want to save up the hassle of running to emergency rooms or struggling to get an appointment with walk-in clinics just by having a family doctor for yourself. So I strongly recommend please get yourself a family doctor. Now, this is not a mandatory requirement, but I'm just telling you out of my own experience. So, the most important question now, how do I find a family doctor? Trust me, it took me almost a month of research to figure out the correct way of getting a hold of a family doctor. The first way is just take a stroll in your area you live and inquire in the clinics if any of the doctors are accepting new patients. So most of the clinics usually display if they're accepting new patients, and if you happen to see one, just go inside and get more details of who the doctor is and how you want to enroll with them. But this is a very tiring process, and often you might not get any clinics near your house where the doctors are accepting new patients. The next process is, which I followed as well, is to register yourself with Healthcare Connect. Healthcare Connect refers people to healthcare providers who may be accepting new patients. So people staying in Ontario, you can call or go online on ontario.ca Healthcare Connect to register with the program. You must have a valid OHIP card and complete a health questionnaire to determine your need for the family healthcare services. Your applications are assessed by the care connectors, and priority is given to individuals who have greater health needs. Like for example, if you have diabetes or you're under any ongoing medications like for thyroid or BP, your case gets priority. Care connectors will work with the clinics and doctors who are accepting new patients. Once an available provider is found, you will receive a call from them and they will provide you information about all available family doctors within your area. Expect the call within 4 or 5 business days or depending on your health needs. Now, this is a very important information. You can look up for the doctor's reviews and history in the CPSO website. This is basically a database of registered Ontario doctors. You can search for the doctor and view the entire history, beginning from which colleges they study from, their practice information, what degrees they have, what certifications and licenses they have, and if they have any kind of hearings against them. Yes, I know that sounded weird, but let's say if a patient did make an official complaint against a doctor and they are under a hearing, all of that information is captured in this website. So you actually get a very transparent visibility on the doctor's practice and can take a call for yourself. Once you do select a doctor from the list you have, Healthcare Connect sends a letter to the clinic or the doctor and refers you, and you will be informed when the referral has been done. This is the first part of the process. Now you have to wait for a call from the clinic or the doctor to schedule your first appointment, usually called as greet and meet with your family doctor. You need to fill out a couple of forms which usually asks you questions about your medical history, the medications you take, and your family history. Once the forms are submitted and you get a final appointment schedule, that's it. You are all set. So the next time you fall sick, you can just call the clinic and they'll be able to set you up with a doctor for a physical or a phone call consultation based on the illness, and you should be able to have the medicines that you need. So there might be instances when your family doctor is not available for whatever reason. In such cases, the clinic usually tries to set you up with another doctor that's available in the clinic. And if even that's not happening, you can just call up a walk-in clinic and try to get an appointment. Make sure you know a few walk-in clinics in the area for such instances. You may get an appointment for the same day, and if not, definitely for the next day. So it's not that not having a family doctor is the end of the world, but it's just much more convenient to have one. Also, for children, if there is an emergency and your family doctor is not available, you can visit the hospital called Sick Kids. You need to go to their emergency room and your child will be attended. Since this is a huge hospital dedicated only for children, unfortunately, the waiting time is anywhere between 4 to 8 hours, but at least you will be under supervision, and if anything serious happens, they will prioritize your case. Another good option is CIBC Just for Kids Clinic, which is inside St. Joseph's Hospital. They have a huge team of doctors and they take in walk-ins. I will have the details of these hospitals mentioned in the description below. Alright, so I have my first meet and greet with my new doctor today. So why new doctor? I did enroll with the doctor back in June when I just came here, but the experience was not good at all. Me, my husband and my son, we were rostered with the same doctor, and every time one of us fell ill, he was always unavailable and we had to keep running to emergency or, struggle to get an appointment with walk-in clinics. So did not make sense at all, and that's when I decided it's high time we change a doctor. And this time I decided, all the three of us should have separate doctors and separate clinics. So my husband and my son already got rostered with their doctors, and till now the experience has been good. I just hope my doctor is a better one this time too. So yes guys, finding a good family doctor is a task here, because honestly you don't have the visibility into the practice unless you're actually experiencing it. Alright, so I've almost reached the clinic and I'm supposed to reach around 15-20 minutes early so that they can check the vitals before I can meet the doctor. So yeah. Looks like this clinic is accepting new patients. People in downtown Toronto, you can check this out. Alright, so I'm back from the clinic and the appointment went really well. I'm already liking my doctor. The process was really smooth. The moment I went in, they checked my health card, they pulled out my details, and then I was escorted to the triage to check my vitals. They checked my BP, my height, my weight, and then they put me in the doctor's room, and I think the doctor came in within 10 minutes. It was not even a long wait. And then she discussed my entire medical history in detail, my family history, and then she wanted to make sure that I'm comfortable in the clinic, I'm comfortable with her, which I really liked. My previous doctor did not do that. So overall it was good. And then my doctor said if I would go ahead for the flu shot and the tetanus shot, because apparently you're supposed to take tetanus shot every 10 years, and I don't even remember when was the last time I took a tetanus shot in India. So I said, okay, why not? And then she also insisted I go for the flu shot because the flu season is already here. And she said, I am going to get fever and my hand is going to be sore, but then it's good for me if I just take it. So I agreed. And here it is. I had both the shots in one hand so that at least my right hand is functional. And I don't know, let's see how the rest of the day goes. I just hope the fever is not bad. Fingers crossed. Complete regret, guys. Taking both the shots on the same hand was a bad idea. So by the time it was night, my hand was completely swollen and very sore. I could not move it, but thankfully there was no fever, so I could get some sleep. It's okay this morning. I mean, it's better, but the soreness is still there. But yeah, all's good. So people in Canada, please go and get your flu shots. It's high time now. And please get yourselves a family doctor. So I'm going to end the video here today. Do let me know in the comment section if the information that I provided was useful to you. And if you did like the video, please like, share, comment, and please do not forget to subscribe. Alright then, stay happy, stay healthy, enjoy the winter season. We'll keep talking. Thank you. Bye.